For years and years and years, I kept a secret what happened in the summer of 1992. I was born and raised in South Jersey. Like many young teenagers, I was struggling with the transition between middle and high school. When I was in middle school, I was completely preoccupied with being accepted. What my traffickers offered to me was acceptance. He said things that made me feel really good about myself. He said that I was pretty enough to be a model, that I was too mature for high school. Within a couple of hours of running away from home, I was forced into prostitution in Atlantic City, New Jersey. Fortunately for me, I was trafficked only for 2 nights. It was the second night where I was spotted. After I had been arrested by law enforcement, I just remember feeling like I'd never felt that lonely before in my whole life. I just felt like everyone looked at me differently. And I remember feeling like the healthcare staff wanted to talk to me, but I could tell that nobody knew what to say to me. For many years, I thought that I was the only person that this happened to. Human trafficking is a domestic issue. We have both sex trafficking here and labor trafficking. I started to become more and more passionate about getting that message out there, about breaking this stereotype of what sex trafficking is, what it means, what it looks like. Dignity Health is the largest hospital provider in California. They have decided to take on human trafficking system-wide, and there aren't a lot of other healthcare systems out there doing this. The program is set up to educate staff how to identify victims and how to work with victims once they're identified. We're setting up internal protocols on how to handle a patient who's identified as an at-risk or actual victim of human trafficking. Some of the main red flags would be that the patient is accompanied by a controlling companion. They're not speaking for themselves. If they're coming across as hypervigilant or submissive or fearful, and then signs of medical or physical neglect. What sets us apart is that leadership recognizes that this needs to be a priority to healthcare staff. Doctors and nurses are among the few frontline professionals who will come into contact with victims. It's our responsibility to make sure that we can identify and properly respond to victims, which is exactly what I needed in 1992. I remember sitting in that hospital room, feeling like no one was talking to me, everyone was judging me. And I think what was missing from that moment was human kindness. I was still just a 14-year-old kid. I wasn't a prostitute, I wasn't a criminal, and I wasn't an adult. I needed compassion. I want to make sure that staff who are working with victims today know what that kid is thinking. And I want victims to know that what happened to them doesn't have to define them or the rest of their lives. What is so empowering is that I'm taking this experience and I'm turning it into such a positive thing to help professionals best respond to victims today.